search section on our resources page. And in that section, you can see a lot of the different research that's been done to estimate the impact here. I think one of the studies we turn to most often is one done by Manatt Health. And they start with this 250% of the poverty line heavily weighed factor. And they look at all families in this country below 250% of the federal poverty line that include one or more non-citizens. And looking at that population, they found that as many as 26 million people could be chilled from participating in health, nutrition, and housing programs under this rule. And we use that word chilled a lot, but what we're really talking about there is fear. 26 million people who could be too afraid to access programs that help them put food on the table or take their families to the doctor. And I know this seems like a huge number, but when you consider the fact that 1 in 4 children in our country have an immigrant parent, it's easy to see how widespread and how devastating this rule is. I'm sure everyone on the call today, if you don't have a non-citizen in your family, you know someone or work with someone who is, and know how real that fear is around doing anything that could jeopardize someone's immigration status. Next slide. So I want to give you an example here to sort of explain how this might work. This example is of Karina. She's been in the United States for 12 years after her son petitioned for her to come over. She's a green card holder and she's 72 years old, and she recently retired from her job as a cashier. She's getting the low-income subsidy program, which is helping her pay for her prescriptions through Medicare. And she comes to you because she wants to return to India to visit her sister. But she's worried that if she leaves the country to take care of her sister, she won't be able to come back. And she worries that she wouldn't be able to be reunited with her son and her grandchildren who live here in the United States. Next slide. So what I've tried to do here is sort of show you how this totality of the circumstances test might play out for Karina if the proposed rule moved forward. So you can see that Karina does have a positive factor. She's got an affidavit of support from her son who sponsored her all those years ago to become a green card holder. But she has a lot more negative factors. Her age, she's over age 61, which remember can be held against her. She's retired, so that unemployment can be held against her. And her receipt of the Medicare LIS subsidy can be held against her. But it's important to note that those changes related to receipt of a benefit would not be retroactive. So that means that receipt of Medicare right now won't hurt Karina, but if she's receiving Medicare Part D LIS after the final date of the effective rule, at that point, the use of the LIS program could be held against her under the public charge test. I'll also just remind you that, remember, Karina is a green card holder. The public charge only comes up for her if she's out of the country for more than 6 consecutive months. Next slide. So we know that a lot of you are working with immigrant families who are probably coming in with a lot of questions about how to address this issue of public charge and how they should change their actions moving forward. I think that the 2 biggest values that we want to raise when we're talking with immigrant families is to let them know that right now, the public charge rules in the United States have not yet changed. Remember, there were changes abroad in the Foreign Affairs Manual, but for people who are lawfully present in the United States and are going to be adjusting to a green card status here, the rules haven't changed. This is just a proposed rule at this point. It's important to remember that the regulation doesn't apply to all immigrants. Remember, I went over those exempt categories. And then it's also super important to empower clients and let them know that they have an opportunity to fight back. We have until December 10th to make our voices heard, and we want everyone to be fighting back, not just nonprofit organizations, but impacted individuals as well. If you're getting questions from folks, I highly recommend a fact sheet I've linked here, which explains some of the top level talking points when you're meeting with immigrant families on this issue. Next slide. As a campaign, we have a collective goal of getting at least 100,000 comments by December the 10th. As I mentioned, we want both organizational high-quality comments, but we also want comments from impacted individuals and community providers like nurses and teachers. You can submit your comment directly on the federal comment portal on regulations.gov. We also have a comment portal on the protectingimmigrantfamilies.org website, but the Coalition for the Future of Oklahoma Families also has a comment portal, and I would encourage you to take a look at that. Ultimately, all these comments are going to the same place, so I encourage you to comment wherever you feel the most comfortable. If you visit our website and you visit the Protecting Oklahoma Families website, you'll see a lot of different resources available that can help you craft exactly what you say in your comment. Next slide. In addition to commenting, which is definitely the #1 thing we want people to do right now, as I mentioned at the beginning, we'd love to have you join us as a member of the national campaign. And we also really are looking for stories of impacted individuals. One of the most powerful ways to show the harm that this rule would cause are stories of real people who are having to think about the fact that they may have to decide between putting food on the table or obtaining a green card, or thinking about what this rule could do to their families. So we have a portal where you can share a story and you'll be immediately connected to a representative from NOC or from CLASP. Finally, we want folks to really be speaking up on social media with the hashtag #ProtectFamilies. And I know that other presenters are going to talk about action steps you can take in the next few slides. So that wraps it up for me, and I'll pass it back.
Thank you so much, Madison. You always do a great job of explaining a very nuanced subject. Public charge and the proposed rule change has so many details to it. I think you always do a great job of unraveling it for everyone. Just a friendly reminder that as questions arise, please feel free to email those to info@hungerfreeok.org. And if you are worried that you missed some information, this webinar will be recorded and accessible afterwards. Now that you have a better understanding of what public charge is and the proposed rule change, we will now turn it over to our coalition members who will discuss the current and potential impact it will have on Oklahoma and the organizations that you may represent. So first off, we're going to pass it along to Richard Camo with Hunger Free Oklahoma, and he will touch on the hunger impact. Richard?
Great, thank you, Katie. So I just wanted to check in with everyone on the call. Thank you all so much for being here. Like Katie said, I'm with Hunger Free Oklahoma, and so obviously we're focused on hunger issues. And when we're thinking about specific to Oklahoma, I think the first thing that came to our mind was how many Oklahoma families could be impacted by this. And so based on some information available from some of our national partners, there are up to 272,586, so nearly 273,000 people who are in families with at least one immigrant in Oklahoma that could be impacted by this rule. So what does that look like for people in the hunger space or people that have clients that are on federal nutrition programs? I think the biggest concern is obviously SNAP. Families participating in SNAP are at higher risk. And we would obviously expect to see a decrease in participation in SNAP. But just as Madison was talking about, we're really concerned about the chilling effect as well. Over the past couple of years, we've actually seen a decrease in participation from some certain populations in Oklahoma and other nutrition programs like summer meals and after school meals. And so we would expect to see that further decrease if this rule does come into effect. So that's sort of the hunger landscape. And if you have any questions, you can always email info@hungerfreeok.org, and we'll get to those at the end.
Perfect. Thank you so much, Richard. Next, we do have Carly Putnam with the Oklahoma Policy Institute, and she's going to touch on the health aspect.
Hey, thanks, Katie. Yeah, so at Oklahoma Policy Institute, we're one of the coalition members for the Coalition for the Future of Oklahoma Families. And at OK Policy, in addition to being policy director, I also do our healthcare research. And we find this rule incredibly concerning, both from what the sort of impact on those who are quote unquote supposed to be affected by this rule could be, and then also the much broader chilling effect. I think I've heard Madison do this presentation 2 or 3 times now. I still don't understand it. And so I keep thinking about how much harder this is going to be for people whose job isn't to try to study this, to understand whether or not they'd be putting their family's future in jeopardy by participating in some of these programs. We know that hundreds of thousands of Oklahomans rely on Medicaid, for instance, and 2 in 3 of those are children. And so especially if CHIP gets brought into this, we could see families trying to decide between whether getting health care for their child or risking their child's future in this country. I know that the rule itself, I believe on page 360 something of the proposed rule, specifically says that they expect participation in vaccination programs to fall off. So there could be significant public health consequences from this. And we also know that when people roll off programs, they often don't get back on. So if someone pulls out of Medicaid or even pulls out of SNAP, to go back to Richard's example, it's unlikely that they will, a month later, several months later, say, oh, I wonder if I should check and see if maybe we could get back on these programs. And when people who qualify for programs like Medicaid, they often don't know how they qualified. So even with disability services in schools or emergency Medicaid exempted, I think we can expect to see decreased participation in both of those as well. So thank you, Katie.
Awesome. Thank you, Carly.
And again, if you have questions, info@hungerfreeok.org.
You got it. And then next up, we do have Jeff Janes with Restore Hope, and he's going to touch on the housing impact.
Thank you very much, Katie. The Restore Hope, for those of you who don't know, it may be in Oklahoma City or even some of you in Tulsa, is an agency that helps prevent homelessness, as well as we also fight hunger with a food pantry. And I was actually the chair of the Tulsa area homeless response group called the Way Home for Tulsa for 2 years. And so housing is an issue that's really important to me, and obviously it's part of this issue with the housing vouchers of Section 8 and some other public housing benefits explicitly mentioned as part of the public charge criteria. It's already very difficult to find affordable housing. And for some people, these housing vouchers may be the only way that they can maintain stable housing. And it can be an already difficult process to access those vouchers. And so to Carly's point about not coming back on, in some cases, if somebody gets out of line for a housing voucher so that they can maintain their status in this country, it may be a year or 2 before they could even get back on the list just because of the list, let alone because of not remembering to reapply or other factors such as that. And so it may mean that this rule change may mean that some families will have to choose between housing their family or continuing their path towards citizenship or legal status in this country. And so obviously the actual effect of the rule can be difficult, but it's also important to recognize that these vouchers don't often represent the majority of the recipient's income. It's obviously an important part of their income, but it doesn't represent the majority of their income. And again, I think this is a recurring theme. The chilling effect could be just as bad or worse. At Restore Hope, we prevent homelessness, and we have several programs to do so. We had a family who chose not to receive our benefits, even though it wouldn't have had any effect on their immigration status, because they were worried that if they were using our benefits, that they might not be able to stay in this country to maintain their status. And so we weren't able to help them, and they were evicted because of fear of a rule that's not even in effect. And if that's the case now, if the rule does go into effect, which obviously we hope that it doesn't, that will only be made much, much worse. And so as difficult as the rule might be, the fear and the rumors that it engenders might actually be worse and may have a longer term effect, even for the groups that are exempted, like refugees and others, or even programs like Restore Hopes that aren't actually covered by the rule.
Thank you, Jeff. And also Jeff had recently published an op-ed in the Tulsa World where he speaks about that story. So if you have the opportunity, that is on our website, and it's on both of our Facebook and Twitter pages as well. So feel free to check out that story as well. Lastly, we do have what this will be as a burden on charity. We have Ellen Pogmiller with the food banks. Take it away, Ellen.
Yes, thanks so much for letting me just come on and talk. We at both food banks, we're generally concerned. We believe federal nutrition programs like SNAP were designed by Congress to be there for all citizens and eligible legal immigrants when they fell on hard times. SNAP does 12 times the amount of work that the regional food bank and the community food bank of Eastern Oklahoma. Food pantries were created as a first line of aid, but we were never created to be there ongoing week after week. The majority of our pantries allow groups to come in a month at a time, which is a huge benefit to those families. But that's about the limit that we can do. And if individuals are choosing not to utilize SNAP or programs like that, nonprofits like the food bank and our food partners will not be able to fill in that gap. And so we're concerned that hunger among immigrant families will increase.
Thank you so much, Ellen. And thank you to our members. So as you can tell, this proposed rule change, it is detrimental to Oklahoma's immigrant families who are here legally. But the good news is that we can do something about it. So until December 10th, like Madison outlined earlier, the Department of Homeland Security has asked for feedback on these proposed changes. There are people across this country, including right here in Oklahoma, who are working to let them know that this proposed change is bad for families and bad for Oklahoma. This is why we have formed this coalition for the future of Oklahoma families. Our position is that families shouldn't be punished for accepting help when they need it, no matter where they are from. The proposed public charge rule change is fundamentally flawed and cannot be fixed. It should be withdrawn. Oklahoma communities thrive when everyone has the opportunity to build a better life with access to adequate food, housing, and medical care. In order to stop this harmful rule change, this coalition seeks to generate around 1,200 public comments to the Federal Register. While Madison outlined earlier that the national goal is approximately 100,000. Now, I just checked the regulations.gov page, and it looks like we have reached 34,037 public comments nationally. So people are already taking a stand on this issue across the country. And we can reach those national goals with your help. So if you will bear with me, I'm going to switch my screen over to our actual web page over here. I'm going to share this. Can people see that?
Yes.
Yes. Okay. Thank you so much. Okay, good. So first and foremost, to get started, visit this coalition's page. So our coalition's URL is www.protectokfamilies.org. If you head here first, the first thing that'll pop up is to submit a public comment. That is going to be your first thing that you are going to do. Either click the submit a comment button right here, or you can head to the action tab and it'll take you to the same spot. So like Madison mentioned, this form right here, this directly talks to the Federal Register. It does it in real time. There are tips here to the left to help construct your talking points. And if you want some more additional information on how to construct your talking points, we have talking points on each little subject area, like hunger, places of worship, housing. This can help you construct that public comment. And second, for those who represent an organization, sign your organization up as a coalition member. So if you head to the Who We Are tab right up here at the top, you will see our position, our goal, and then of course the join us part. So if you click on the join the coalition, it will take you to a form, and that way you can sign up your organization as a member. The bigger our coalition is, the stronger our message is to Oklahoma, is that Oklahoma thrives when everyone has the opportunity to build a better life. And then third, I know this may be a little scary for some people that are not familiar with it, but it's social media. Share, like, encourage others to make a public comment. Now we have a tab up here for resources. And I'm sorry, I probably did that a little too quickly. So we'll go back to resources up here at the top. We have various other resources, which I'll get to in a second. But right here in the middle is the social media resources tab. Here you can find graphics that are ready to share. We've also created a lot of sample posts so that you do not have to. You can literally copy and paste it and put it into your Facebook or your Twitter or your organization's page. Now, if that sounds like too much, do not fret. We do have these buttons right over here to the left. If you hit this Facebook button, it will automatically populate the website into your Facebook. That is me, Katie Gilmaxey. It is now on my page, and if I just press post to Facebook, it will directly go to my Facebook. That's how easy that is. It is extremely important that we not only spread awareness to our contacts, our friends, our community, but that we also encourage others to make their voices heard by submitting a public comment. Excuse me, sorry, I'm gonna leave this. So I do want to run through some more resources on this page before I leave. So like I mentioned, we're on this resources page right here. There are these other resources that you can take advantage of. One thing I like to point out is the outreach section. Now, some of you may have actually received this outreach email right here. We have provided that so that you can contact other organizations and more of your own contacts. We also have a sample worship bulletin insert. So if you want to include that with your place of worship, we have a very easy front and back bulletin inserts ready to use. And if we head back up to the top, one more thing I want to point out, the national organization statements. So there are a lot of us on the call today that are with nonprofits, and we understand that sometimes we can't commit ourselves to as a coalition member or just doing some small actions. Sometimes you need board approval, right? So sometimes these national organization statements can really hit home why this is important, and you can use this to encourage your board to encourage yourselves to be as a coalition member. So we have the U.S. Conference of Mayors has opposed the proposed rule change to public charge, various healthcare associations, and then the National Education Association as well. So I just wanted to point some of those things out. And then real quickly, if you go up to the media tab, as I mentioned, there's the Jeff Janes Tulsa World op-ed article right here. But as public charge information and media comes through, we will be updating this website in real time as well. So I know that was a lot. I am now going to switch my screen right back over to the PowerPoint. Give me one moment. Here we go. Can everyone see that? Yes.
Yes.
Okay. Oh, perfect. Thank you. So as a recap, first things first, head to our protectokfamilies.org webpage, submit your public comment, join the coalition, and then, of course, share on social media. We want to make sure that we can send a message to the administration and that this proposed rule change would be detrimental to the health and well-being of every Oklahoma family. Okay, so I believe we're ready for some Q&A session. Again, to ask a question, please email them to info@hungerfreeok, and then we will answer as many as time permits. So we do have one question. It looks right here. Can someone talk about the school resolution? I believe we can. Yes. Okay, so let me actually switch my screen. I can pull up the school resolution. Here we go. Because we have this as a resource on our webpage. Let me share that. Perfect. So again, if you go to the resources page over here, we have those outreach resources. We have a sample school board resolution. It's form ready to fill. Let me pull it up for you, everyone. But it's just a very simple school board resolution. It is strongly opposing the proposed rule change.
Katie, correct
yes.
me if I'm wrong, but I think Tulsa Public Schools is going to consider this soon.
They hopefully will be considering on this next Monday, the 5th, in their board their board meeting that evening. Yes, so we have shared this. Please feel free to share this with your own school district. This can really send a message to those families that attend those schools, to their students, that, you know, we care for them and that we're opposing this proposed rule change because it would be terrible for a school's family. Do we have any more questions?
Yes, we do.
Oh, we
have
do.
A question for Madison.
Oh, Madison.
Madison, are y'all seeing any effects nationally on program participation, or have y'all heard any stories about people withdrawing on a big scale or really chilling?
Yeah, unfortunately, the answer is a resounding yes to that question. Our partners at the National WIC Association are seeing a nationwide decline in participation in the WIC program, which, as you know, is not even being proposed as one of the programs that could be considered under the proposed rule. We heard a story of a young mom with DACA status who actually went in and returned her breast pump and said that she no longer wanted to be affiliated with the WIC program because of these fears. We're also hearing from physicians and nurses across the country who are seeing families dropping off of their Medicaid and CHIP enrollment, and children that are just not showing up for their appointments anymore. So we've been hearing these stories since the executive order on public charge was leaked back in early 2017. But in recent months, the number of these stories that we're hearing have just skyrocketed. And we're really worried that if this proposed rule moves forward, about how many families will be disenrolling themselves and their children from programs that really support their health and well-being.
Thank you, Madison. We also have another question. I'm shooting it towards you. What happens after December 10th? What happens after this public comment is finished? What should we expect?
That's a great question. So the notice and comment period will end, and then by law, the Department of Homeland Security is required to review and respond to every single unique comment that they receive. And so under a typical administration, a rule that generates tens of thousands of comments should take months, if not years, to review. There's nothing typical about this administration, but we do think at a minimum it will take at least a couple months for the Department of Homeland Security to review all of the comments. The next step, once they've reviewed the comments, is to issue a final rule. And the preamble to that final rule is where they will be responding to all of the different comments that they've received. Once the final rule is issued, the rule will not actually be effective until at least 60 days after the final rule is issued. So we've heard some advocates refer to that as sort of the grace period, and that would be the time period where families would be making the determination about how they may or may not want to change their enrollment in programs, whether or not they want to move forward with green card applications before the rule actually becomes effective.
Thank you so much, Madison. It looks like we have no more questions, but someone did send in, it's more of just a statement, that they've heard from other school districts in our state that they've seen a decline in free and reduced price applications. So if anything, this again shows you that this is not something that will potentially happen. It is happening, and it's happening in our state, and it's happening to our immigrant families. Now, if we don't have any more questions, I do want to thank our presenters today. I want to thank you, Madison, for joining us from CLASP, and most importantly, thank you all who took the time out of your day to learn about this potential harm on Oklahoma's immigrant families. Be on the lookout for an email from me regarding the recorded webinar and exactly where to find it. And again, thank you so much, and I hope everyone has a wonderful afternoon.
Thank you.